Sleep. It's important. Everybody's talking about sleep, right? You or a loved one may have been diagnosed with sleep apnea and may be looking for a solution other than a CPAP, right? CPAPs can be a little uncomfortable, I've heard, and there's actually a dental solution for sleep apnea. There's an oral appliance that can be used. Today, we're sitting down with Dr. Bauserman. He is from Better Sleep, Mid-Ohio Valley, and we're going to talk a little bit about this appliance and how it can be used to treat sleep apnea. How are you, Dr. Luke?
Doing good. How are you, Jenny?
I am great. Thanks for joining us.
Yeah, thanks for having me.
Absolutely. So, how does a dentist get into treating sleep apnea?
That's a good question. I started my dental career as a dental assistant. And as a dental assistant, one of the dentists that I worked with provided this oral appliance therapy for his patients.
Okay.
And fast forward, I went to dental school. And depending on where you go to dental school, you don't learn a lot about sleep apnea. You're kind of focused on teeth and that kind of thing.
Of course.
But I graduated from dental school, was in private practice for a few years, and I received some requests from some physicians in the area that were looking for an alternative treatment for their patients that couldn't tolerate CPAP machines. And they wanted to know if we could provide oral appliances for them. Well, I remembered my days as an assistant, and because of that, I was able to go seek out extra training and went through hundreds and hundreds of hours of training on that. And here we are providing this treatment for many patients these days. And we love doing it because it just makes such a difference for people.
Oh, I'm sure. What a life changer. So how is the oral appliance different from a CPAP? Is it comfortable?
Yeah, that's a great question. So a lot of the challenges that people run into with CPAP machines are related to the mechanism that it's using to treat sleep apnea.
Okay.
I've got a little model here with me that kind of helps illustrate this. So sleep apnea is a problem that's usually occurring behind your tongue. So we got somebody's face here, their mouth, this is their tongue. And you go to sleep, and we all like to think that we sleep and we're just looking, it's like Sleeping Beauty. But the truth is a lot of us are sleeping like a middle-aged man with our mouth open, maybe snoring. And your jaw and your tongue can actually fall back along with some of the other soft tissues in your airway.
Okay.
And cut down on your ability to breathe. When you're awake, you're breathing through a garden hose, and then at night, you're breathing through a coffee straw at best. And the way that a CPAP machine addresses this problem is it consists of a mask that you wear that's connected to a hose. And that is going to create positive air pressure. So air is going to be flowing in and past this obstruction in your airway, kind of blowing things open, so to speak.
I see.
An oral appliance has the same goal. We need to open up this obstruction, but instead of doing that with positive air pressure, what we're going to do is create a mouth guard that kind of stabilizes your jaw and maybe even gently brings it into a protrusive position to bring the whole floor of your mouth forward and open up your airway. It's the same goal, different way of accomplishing it.
Oh, very cool. Okay. Well, that's neat. I can see how that would be some more preferred than a CPAP.
In some cases, yeah. I think the challenges that I hear about when somebody doesn't have a CPAP that's working well for them are their sinuses might be getting dry.
Mm-hmm.
They may be having leakage issues around their mask. Sometimes the noise of the machine itself is making it hard for them or their bed partner to sleep.
Mm-hmm.
And that's not to disparage CPAP at all. For the people that it works for, that love it, we're just happy that they're treating their sleep apnea. But we're here if that's not working for them.
Awesome. Okay.
Yeah.
Well, I'm sure another big question on folks' mind, cost. Is this something that insurance covers at times, or how does that work?
Sure. So there's often some confusion when you're talking about a medical issue that a dentist is helping treat. And for some offices such as ours, we're dentists that choose to work with medical insurance, and medical insurance is what would have coverage for sleep apnea. That's going to vary from plan to plan, but we have a team that works really hard to make sure that patients get coverage for this treatment if they have it. And if they don't have coverage, we have flexible payment plans. We try to be as accommodating as we can because this is a life-threatening issue, and we want to make sure that people have access to the care that they need.
Oh, that's great. So you do not have to have insurance in order to get.
You don't have to. No.
Great. Awesome.
Yeah. And you were asking about comfort. So with the appliance itself, they can actually be quite small. There's many different designs to make an oral appliance. This is one example of it.
Wow,
But
I didn't think it would be that small and
right. It's not that different than wearing, say, retainers.
Sure, yeah.
If
That's
you've
what
ever
it
had
looks
some
like.
braces or a night guard. We find that with anything new in your mouth, whether it's a night guard or retainers or one of these, the vast majority of people, after about 2 weeks of wearing it, they've forgotten that it's even there.
Oh yeah, I can see that.
Yeah.
Very cool. Well, Dr. Luke, thank you so much. This has been really informative. And yeah, if you or anyone that you know is in need of sleep apnea treatment, please come see us at Better Sleep MME.
If you have questions about sleep or are looking for a solution for your sleep apnea, we would love to help. Give our office a call at 740-205-6103.